Hello students of class 11. Welcome to the online tutorial classes for Vidya Bhavan High Secondary School. This video is for class 11 nutrition and the chapter that I am continuing today is the vitamins. In the previous video we discussed about the deficiency diseases led by vitamin D deficiency, and we talk about the younger people's problem. That means when the deficiency is in younger people, what are the diseases can be formed. That was ricket. In this video we will discuss about the osteomalacia and osteoporosis. Osteomalacia usually called the adults ricket, and osteoporosis is one more disease that can be seen in the deficiency of the vitamin D in adults. Okay, so let's check them with the pictures and let's know what are the prevalence, what are the symptoms, what are the prevention and the treatment for those diseases. Now we are going to talk about the adults ricket, that is osteomalacia. In the adult counterpart of rickets, it is called the osteomalacia, refers to bone softening. The prevalence of the disease is the osteomalacia is commonly seen in females among adults, mainly those women who follow the parda system or the burqa system, or who are confined in their homes have these diseases. Such women are and the childbearing age is consume cereal based diets poor in vitamin D and calcium, also are the sufferer of these diseases. First pregnancy is the most common time period of the occurrence of the osteomalacia mainly. So, what are the pathology of it? The biochemical changes in blood and essentially the same of those in the rickets can be seen. The bones become declarified and these tissues are replaced by the soft osteoid tissues. So, first we are going to discuss about what is the causes of it. So, lack of dietary intake of vitamin D and sunlight can be the main cause. The malabsorption of the vitamin D due to the intestinal problems can also be a cause. The secretion of milk during lactation is also can be a cause. The excessive demand in the pregnancy, if it is not replenished, then the vitamin D deficiency osteomalacia can be formed. The impaired 25 dehydroxylations of the liver due to these liver diseases can be the cause. The impaired hydroxylation of the first position, which occurs in the kidney due to kidney diseases, can be the cause. The complete shielding of the by the porda, shielding by the porda from exposure to the sunlight can be the cause. The hyperpigmentation in dark skinned people leads to the less production of the vitamin D can be the cause. It is seen in mainly old people have improper food intake. And now we are going to discuss about the clinical symptoms. What are the clinical symptoms have in this osteomalacia? So first, the skeletal pain, the bony tenderness, the fractures, the low density of bone matrix, the deformed bones, the pseudo fractures or the looser zone, the deformities in ribs, vertebrae, pelvis, legs, etc. The muscular weakness can be the cause. And now the treatment, a daily oral dose of 125 mg of the vitamin D cures the osteomalacia. 10 milligram of vitamin D regularly can prevent the osteomalacia. Sometimes a single massive dose of the 50,000 international unit can be given intramuscularly, which can last for 6 months. After 6 months, the patient should consume a daily 400 international unit of vitamin D. The best source of vitamin D and calcium is milk, and this should be consumed in proper amounts to prevent osteomalacia. So now we will talk about the osteoporosis. So this is the picture of the osteoporosis. In the left one it is the healthy bone and the right one it is the osteoporosis. So the frequency in which the osteoporosis developed in the woman after menopause in the fact of much more common in women than the men, has led to the view that a failure in sex hormone secretion may be one of the factors concerned with the production of this type of osteoporosis. The similar condition in men, often described infantile osteoporosis, is throughout the can be related to the diminished androgen formation. And also, the second cause can be the calcium and the vitamin D deficiency, that is, the high fecal content of calcium and low calcium absorption can be reported as osteoporosis by some workers. This suggested that the failure of vitamin D and calcium absorption is due to this happens due to this. The third cause can be the immobilizations and the insufficient physical activity. The immobilization of the limbs for any reason due to the it can be leaded to the demineralization of the bone. In support of this view, it can be finding that the independence or the incidence where the osteoporosis in old people in high in Western countries and very low in the people in underdeveloped countries who have to carry out the basic physical activities for survival. The main clinical features of the osteoporosis are the skeletal pain is associated with the fracture. The fractures are very common which heal normally. Loss of density of bones is irregular and often most marked in the spine. The bone reduced in quantity but fully mineralized. What are the treatments of it? If treated with the sex hormones is advised for a woman because the of pain and frequency of fractures. The cytosterol is recommended as a dose of 1 to 3 mg per a day in the period of 4 to 5 weeks. More senile osteoporosis in means methyl testosterone may be given continuously in the dose of 25 to 50 mg a day sublingually for 2 weeks. It is also essential to make sure that the dietary intake of calcium and the vitamin D is satisfactory. Okay, so this is all about the osteomalacia and osteoporosis. Students, I think you understood what are the deficiency causes of the vitamin D, as well the what are the diseases can be formed due to the deficiency of the vitamin D. So I'm completing the vitamin D related video with it. In the next video, we will start a new vitamin. Till then, thank you.